Welcome to traumaticbraininjury.com. Traumaticbraininjury.com is the leading resource on the internet for resources regarding traumatic brain injury for survivors, families, and caretakers. My name is Stuart Cohen. Today's guest is Dr. David Lenrow. Dr. Lenrow is a physician who specializes in physical medicine and rehabilitation. He's on staff at the Hospital University of Pennsylvania since 1987, and he's also on the faculty at University of Pennsylvania Medical School. Dr. Lenrow is involved in treating patients with traumatic brain injury as a regular part of his practice. Dr. Lenrow, thank you again for agreeing to appear on traumaticbraininjury.com. I have some questions for you regarding what happens when a brain injury occurs. Physically, what happens to the brain?
Well, there are several potential mechanisms of injury to the brain. The traumatic ones generally are classified into a direct trauma of the brain, so a direct blow to the head hard enough to either damage the brain directly, either by a skull fracture that might push into the brain, or an obvious example is a gunshot wound that actually penetrates the skull and goes into the brain. And then there's another set of injuries, which are closed head injuries, where the force in the brain may not break the skull and cause a direct trauma to the brain, but it causes enough of a force to cause the brain to move within the skull, or the skull to move and the brain stays still and damage the skull. So the skull can, the brain can bang against the skull and get damaged in that way. So for instance, in a car accident where the car stops abruptly, the brain can actually bang on both the front and back of the skull and cause an injury on both sides of the skull.
And this is a brain injury, an injury to the brain inside the skull, if I'm understanding you correctly. Is that right?
That's right.
All right, and that's without the skull being fractured?
That's correct. So there's no damage to the skull itself. There's no penetration of the skull, but the brain either moves and stops so fast that it gets damaged itself, and they call them acceleration-deceleration injuries. And even sometimes the force is a twisting sort of force, and a deceleration and acceleration injury, that the axons or the fibers that connect one nerve cell to the other get torn or damaged. And that can be a very diffuse injury with no evidence on the outside of the skull that there was a trauma.
Well, let me just ask you a practical question. Someone's riding in a vehicle. They have their seatbelt on. There's a severe impact. Let's say it's from the rear. And the car that they're in strikes the car in front of them. And there's a second impact when the car that they're a passenger in strikes the car in front of them. Do you understand the example I'm giving you?
Yes.
In that kind of example, where the person is restrained in the vehicle by a seatbelt, could there still be a brain injury?
Yes, absolutely.
How would that happen?
Because even though they're restrained, which protects them from direct trauma, so they're presumably, if the restraints work right, the body's not going to fly forward and their head hit the windshield. But if the car is moving, let's say 60 miles an hour, and stops abruptly, then since their brain's floating in fluid, it potentially can keep them moving. And when the car is struck from the rear, their head actually will jerk backwards first, and their brain will get jolted within the bony cranium or within the skull, and can hit the inside of the skull.
I thought you told us earlier today in one of the other sessions that there was some fluid inside the skull. When you said that, my impression was, oh great, there's some kind of cushion or protector. Is that what the fluid's for?
The fluid is for that, but it's certainly not perfect, and it doesn't prevent injury when the acceleration or deceleration, or the force that hits, is so strong that that fluid moves out of the way. So that fluid is actually in continuity with our spinal fluid, and it sort of floats around and bathes the spinal cord as well, so it's just pushed out of the way if the force is fast enough and hard enough.
All right. So there's essentially two different kinds of brain injuries. One where the skull is fractured, a so-called open brain injury. Is that right?
Yes.
And the second is this closed type brain injury.
That's right.
In another one of the sessions, you've talked to us about mild, moderate, and severe brain injuries. Do you recall that?
Yes.
Can you have, with these closed brain injuries, severe and moderate brain injuries, even without the skull being fractured?
Yes. Yes, you can.
Thank you, Doctor.
You're welcome.